I'd like to welcome everybody to today's presentation on exploring depression from a functional behavioral health perspective. I'm your host, Dr. Dawn-Elise Snipes. Today, we're going to define functional behavioral health and explore the symptoms of depression and causes, consequences, and interventions from a functional behavioral health perspective. And I use the term functional behavioral health because we are not doctors. So I don't like to use the term medicine since that's not what we're talking about, or that's not what we're licensed for. We are really looking at the field of psychoneuroimmunology in a lot of what we're talking about today. And that's, great big word, but you break it down, it makes sense. Functional behavioral health is a personalized, patient-centered healthcare model that focuses on identifying and treating the root causes of chronic illness rather than just managing isolated symptoms. Rather than just trying to attend to somebody's mood or their cognition or, let's try to address this little symptom over here that is bringing you in today. Let's look at what's causing that symptom. Imagine that, Depression is a physiological issue. It is not just a mood issue. It is not just a thinking issue. It is an integrated physiological issue. When we experience emotions, where do those come from? Those come from a soup, if you will, of different neurochemicals and the activation of different receptors. There's a physiological basis to it. When we think, we have to use our neurological system. We have to activate our brain regions. There are physiological underpinnings to how we think, how we feel, what we see, how we interpret stuff. So, depression, back to what I was saying, is a physiological issue with evidence of inflammation, both systemic and neuroinflammation. And one of the most common or prevalent underlying correlates to depression is inflammation. If you've watched other courses that I've done, you know that when we are chronically stressed, our stress hormone, cortisol, loses its effectiveness. Now, normally, cortisol is a powerful steroid. So when we're in the fight or flight zone, it suppresses inflammation. It helps mobilize resources for energy. When we are chronically stressed for one reason or another, not just emotionally stressed, when there is chronic stress, the body, the receptors are regularly exposed to cortisol. And just like anything else, the body starts to develop a resistance to it. We have people that are insulin resistant. We have people that develop a resistance to alcohol. They need to drink more in order to get the same high. And we have the same resistance to cortisol. Our body is designed to operate within a very narrow window, a homeostatic window, as they say. And when we are regularly bombarding those receptors, when they're getting overactivated, either too intensely or for too long, they're going to adjust. They're going to downregulate, which means cortisol loses its ability to suppress inflammation. Additionally, when we're chronically stressed, we start to see other changes in the body that we're going to talk about that contribute to inflammation in the body. When we have inflammation in the body, for whatever reason, it makes our blood-brain barrier more permeable. So some of those toxins can get into the brain area and cause neuroinflammation and activation of the microglia, which are basically the immune cells in the brain. So that was a lot of blah, blah, blah to explain, I guess, that the depression often has an underlying inflammatory component. And until we address that underlying inflammation, the entire system's going to be out of whack. In depression, we also see a fair amount of people with HPA axis dysregulation. Now, I prefer to say sympathetic nervous system dominance, But basically, the stress response is out of whack. The person may feel flat, depressed, apathetic, anhedonic, whatever word you want to use, most of the time. And when they get triggered, it takes a lot to get them triggered, but when they get triggered, they go to from 0 to 250. We see metabolic disruption in a lot of people with depression. Why? Because stress triggers the stress response and the release of insulin, which can lead, and chronically can lead to insulin resistance. But inflammation itself is a stressor that can trigger the release of insulin, which can compound that bathing of the receptors in insulin and contribute to insulin resistance. So we start to see insulin resistance, metabolic disruption in people with depression. Very common. As a consequence, if you will, of chronic activation of that sympathetic nervous system. And it doesn't have to, well, I'm getting ahead of myself. We'll continue with this slide and I'll say that stuff later. The gut-brain axis is also altered when we're stressed. The little critters that are in our gut that are designed to break down food and make the components so we can have the hormones and neurotransmitters and nutrients that we need to survive, we have a whole different crew that comes in, and they will make different neurotransmitters, and they create a different environment that is actually toxic to the healthy, relaxed microbiome. When we have persistent stress, as a result of those changes, we're making less serotonin. We're also seeing the mucus lining of our gut become thinner, and the junction between the cells in our gut become looser. So we start having leaking of toxins through our gut into our system that go up into our brain that cause, not only do we have systemic inflammation, but we have neuroinflammation. Guess what? That's a stressor. It's going to trigger the stress response. So see how we really have to look at this underlying loop, because if we don't address the underlying inflammation, if we don't address the underlying physiological contributors in addition to the others, we're going to continue to have somebody who struggles with inflammation and stress and dysregulation. We also see, as a result of chronic stress, changes in sex and thyroid hormone balances. When people are stressed for too long, the way the body responds to estrogen, testosterone, progesterone, even oxytocin changes. And because all of these things are interrelated, we also see an alteration in neurotransmitter functioning. Dopamine, norepinephrine, serotonin, acetylcholine, and I'm forgetting one. But in any event, all of these things work together. You have what we call your HP, or what I call your HP axes, your hypothalamic pituitary adrenal axis, which is your HPA axis or your stress response. You have your HPT axis, which is your hypothalamic pituitary thyroid axis. And you have your HPG axis, which is your hypothalamic pituitary gonadal axis. And all of those interact. When you're stressed, they all change. When you're relaxed, they all change. One changes, it's going to alter the balance or activity of the other two. We all, well, most of us, I think, know, the key feature of depression is feeling sad, hopeless, or apathetic. When people are depressed, they feel down, blue, tearful. Physiological changes underlying symptoms are driven by stress in one or more pieces of life. And pieces stands for physical, inter and intrapersonal, emotional, cognitive, environmental, and spiritual. When we have stress, let's say cognitive, if you're a cognitive behavioral therapist, great, I am too. Our thoughts and the way we perceive situations help our brain register whether we're safe or we're experiencing a threat. And if we register those sensations or that sensory input as a threat, so if we have stressful thoughts, if you will, it triggers the stress response, which triggers all the stuff we've been talking about. And yes, addressing thoughts and addressing emotions is extraordinarily important because they can keep people stuck in that inflammatory loop. But we don't want to assume that it's just thoughts or emotions. We need to look across the whole person, the whole spectrum, or as I call it, all pieces of life. Failing to address the myriad of underlying causes of inflammation sets the person up for failure. Sometimes we'll hear about treatment-resistant depression, and in my opinion, a lot of times that's thrown around when people don't respond, by doctors, for example, when people don't respond to an antidepressant. Well, their depression is treatment-resistant. No, it's not. Maybe serotonin wasn't their problem. Maybe something else. They've actually done studies and found that only about 40% of people have any meaningful response to antidepressant medications. Wow, that means 60% they take an antidepressant medication. The doctor says, oh, you're not getting better, you're treatment resistant. No, it means you're treating the wrong thing probably, but I digress. Treatment-resistant depression is often seen in people whose treatment has been unifactorial. Go to the doctor, get a pill. Go to a therapist, address your thoughts. But we're not looking at the big picture. And failure to consider all of the potential domains, including those that perpetuate inflammation, really prevents the person from reaching their highest quality of life and best level of recovery. Diverging a little bit from depression, resistance. It's a word that I love and hate at the same time. It is shorthand, but too often it is used critically or to pathologize something that is going on in treatment. This client is resistant to treatment. Well, when you're working with somebody with depression, sometimes they feel like they just can't. And you're like, well, just can't what, doc? They just can't anything. I can't get out of bed. I can't take a shower. I can't put two thoughts together. Anything you ask me to do right now, I just can't. I'm doing good to be conscious and breathing. And that's not an exaggeration. People with significant major depressive disorder are exhausted. Part of this is due to the physiological alterations underpinning the symptoms. Other causes of resistance, especially to treatment, doing what we, quote, ask them to do, or what we think they, quote, should be doing. Why aren't they doing these things? Well, they may not feel like they can. They lack self-efficacy. It's like, well, why should I try to change this? Because I'm not going to be able to make it any better. They may have lack of buy-in to the process. If we're asking them to do something like practice mindfulness meditation in the morning, afternoon, and evening, if they don't understand why, what's the purpose, what's the function, how is this going to help me, they may not have a whole lot of buy-in. They may be too overwhelmed to even start doing anything, which goes back to the I just can't. I'm too overwhelmed. I've got this grief. I've got these feelings. I've got these thoughts. I don't have any energy. I can't. They may not know where to start. Do I start by changing my sleep? Do I start by addressing my issues with my mother? Where do I start to address? I don't even know where to start, what to do. And this is where we can be really helpful as clinicians. We can help people break it down into small, very small, manageable micro goals. They may lack the skills to do what we're asking. If we ask them to pause and think before acting, well, that sounds super easy to do. But a lot of people lack the skills to pause. They go straight from flat to furious, and there is no thinking time in between. So asking them before they start raging, to stop and think about whether that's the best reaction. Not helpful. They probably don't have the skills to do that right now, or guess what? They probably would be. And they may have difficulty translating skills into abilities. What somebody can do when they're calm and in session is very different than what they're going to remember to do when they're stressed out in daily life. Essential first steps when we're working with people with depression. Complete a comprehensive assessment of all strengths and stressors in all pieces of life. And it's important that we include the strengths. What has worked? What is going well? What things do we have that aren't a problem right now, as well as the stressors. It's important to note that this is rarely a one and done. If you've been working in the field for a while, you know you'll be working with somebody for a month, maybe 6 weeks, and they're like, oh, well, I haven't told you this yet. Or you're working with somebody for a month, maybe 6 weeks, and something changes in their life. We need to respect life on life terms. And what life was like for Jane when she started the program 6 weeks ago may be totally different now. Maybe she had a baby. Maybe she moved. Maybe she changed jobs. Maybe her spouse was diagnosed with an illness. I don't know. But we do need to regularly check in on all of those pieces of life to recognize if there have been changes, and even smaller changes, like they got a new boss, or somebody else was hired where they work and they're trying to navigate that new relationship. It's stressful. It takes energy. Anything that takes energy can be considered stressful sometimes. Assessment questions we want to think about asking. What is their age? And I know you're like, age? What does that have to do with it? As we age, male or female, as we age, our body's ability to produce gonadal hormones drops. And with those drops means we lose neuroprotection, we lose anti-inflammatory components, we lose certain mood moderating activities that our primary gonadal hormones did, which is why we tend to see increased irritability and sometimes increased depression in older adults. So let's ask about their age, get an idea of physiologically where they might be at. For premenopausal women, asking about their cycle phase. And some people get really burly when I talk about that, but it's a reality. Premenstrual dysphoric disorder is a reality. And even if people don't have PMDD, alterations in their progesterone and estrogen levels, or pregnancy, I didn't even put that one on here, can have significant impacts on the levels of their neurotransmitters and their mood. I worked with a couple of people who had bipolar disorder over the years who were much more likely to have breakthrough symptoms when they were in certain places in their cycle. And that was vital to know. Sleep quality, how is it? And going along with that, circadian rhythms. A lack of sleep is a huge stressor on the body. When we sleep, our body consolidates memories and does all that kind of stuff. But it's also when it detoxes and it rebalances and it resets everything. If we are not getting that deep sleep, when our body rebalances and resets, we're going to have a problem. Medications, including GLP-1s, medications in and of themselves, many of them have side effects. Statins, which are your cholesterol medications, are known to contribute to symptoms similar to depression, if not outright depression in some people. Being aware of their medications and the onset of symptoms in relation to the medications. If they've been taking beta blockers or statins for 20 years and they just started to experience depression 6 months ago, probably has nothing to do with it. But if they started taking the medication and shortly after started experiencing the symptoms, might be a clue that they need to go back and talk to their doctor. Obviously, we are not going to recommend any medication changes, but we should, in my opinion, recommend them advocating for themselves if the medication seems to be negatively impacting their quality of life over the long term. Now, beta blockers, my daughter was on them for a while, and they're hellish. Forgive the phrase, but they are. And the first 3 weeks she was on them, she was an absolute zombie. She was so tired and so groggy. And yes, her body did adapt. Sometimes doctors will say you have this ramp up period. And it's important to help the client figure out what they need to do. Sometimes the client has no choice but to be on the medications. Okay, it is what it is. What can we do to help you improve your quality of life? And working with them, and if they're willing, to allow you to communicate with their doctor to coordinate an approach to help them have their highest quality of life. Because people who are experiencing significant problems in their quality of life as a result of a medication are really highly likely to discontinue it completely. And that's not what we want either if the medication's treating an underlying issue. But I digress. Okay, so medications, we want to look at those. How are they impacting you? And what is the relationship between when you started the medication and when your symptoms started? We also want to look at GLP-1s. They have determined that GLP-1s have a significant impact on dopaminergic receptors. Well, people with depression often have low motivation, apathy, low dopamine. In addition to alterations in serotonin and norepinephrine, acetylcholine, etc. That in and of itself can be a problem. Additionally, some people that are on GLP-1s are only eating 800 calories a day, which is not enough to get the full complement of nutrients their body needs to sustain health. And that can be a problem too. That is a whole different therapeutic issue. But if they are on GLP-1s, especially recognizing the impact it has on their mood and motivation is really important. There's studies coming out now and anecdotal reports coming out now of people saying that their entire mood or their entire personality changed once they started taking the GLP-1s, and things that they used to enjoy, including sex, just don't do it for them anymore. If they have a history of bariatric surgery, another important question, same principle. When people have bariatric surgery, it either shrinks the stomach or a lot of times it bypasses big parts of the intestines, which prevent absorption of certain nutrients. There are a lot of people who've had bariatric surgery, had great success. I'm not dissing it. Every person is unique. But there are also a lot of people who have reported the same thing as the GLP-1s. Once they had bariatric surgery, their personality changed. They felt more irritable a lot of the time. Bariatric surgery obviously can't be undone, but if they've had it and they're within a few months or even a year of bariatric surgery, they start having significant mood symptoms, then they may need to double back to their doctor and get a nutritional reassessment. Maybe there are supplements that they need to take. Maybe something needs to be adjusted. If they have chronic pain, well, that makes anybody grumpy and is a stressor and impacts sleep. If their nutrition, even if they haven't had bariatric surgery or are on GLP-1s, if their nutrition is crap, what we eat is broken down to make what is needed in order to keep the body going. And if people are not eating the right inputs, then their body can't make the right outputs. And a trauma history. We don't need to go deep into the trauma evaluation, but understanding what histories of trauma, what things in their past, or do they have things in their past, most of us do, that left them feeling unsafe and powerless. especially those things that still pop up and may make them feel unsafe and powerless. They have those flashbacks. Other questions: what was different before the symptoms started? That can help you identify certain stressors that may be perpetuating. What triggered this particular episode, if known? And if you've experienced depression in the past, what helped you in your recovery? These are strengths-based questions. What do we know? What facts do we have? Sometimes people develop depression and it feels like it came from out of nowhere. With people who have bipolar disorder, it kind of can be. But ultimately, under the hood, in the body, there are physiological changes that are happening that are causing alterations in the receptor activity or in the neurotransmitters themselves. Essential first steps: help the client define a rich and meaningful life. This gives us a goal. This is where we're working toward. People who feel depressed are exhausted. There's no hope. There's no light at the end of the tunnel. It's just a tunnel. If we have light to move toward, sometimes we can muster a little bit of motivation. What is it that they envision in their rich and meaningful life a year from now? Or if they woke up tomorrow and they were no longer depressed, use the miracle question. Educate people about how stress in any piece of life perpetuates depression. Help them understand it's not something that they can necessarily just think away. Their thoughts are often shaped by prior experiences and reactions. People are more complicated than a lot of times they give themselves credit for. And helping people understand that this is a physiological as well as a psychological issue often can help them feel less guilty and more empowered to do something about. Help people identify 1 to 3 stressors that they want to address first. There may be a list of 15 things that are adding stress to their system, but every stressor we remove is going to turn the heat down some. And every time we turn the heat down, we are helping reduce some of that inflammation. And help them set smart micro goals. That's specific, measurable, achievable, relevant, and time-limited micro goals. And I know I've said micro goals about 5 times already, but it's important. Micro goals is what can you do today? What can you do before noon? Not what can you do this week. For somebody with depression, thinking about having to do something every day for a week may be more than they can even, they fall back into that, I can't. Get up every day and take a shower. Today, take a shower. I can do that. I can do that. And I can try to do it tomorrow. But encouraging them to start setting micro goals. Physical drivers and consequences. So now we're going to go through some of the things, and obviously I can't possibly go through all of the things, but we're going to go through some of the things that may perpetuate systemic inflammation and gives us areas to explore for our clients. Sympathetic dominance is one of them. Now we have in our autonomic nervous system, we have the parasympathetic and the sympathetic. The sympathetic is the stress response, and the parasympathetic is the relaxation, rest, digest, repair, all of those R's response. When we're stressed for too long, as I mentioned, cortisol loses its functioning. Our body starts having too much insulin pumped in, so we start developing insulin resistance. That's all problematic. But we also find that the amygdala becomes more powerful, the fear aspect of our brain, and our stress response often kicks off easier. We have a much more hair trigger when we start developing sympathetic dominance. And not only are we more easily irritated, but that irritation is, or fight or flight, is often more pronounced. So we have dysregulation. It can be nervous system dysregulation. It can be emotional dysregulation, whatever you want to call it, but it's dysregulation. And sympathetic dominance, a lot of people who have sympathetic dominance are almost unable to completely relax. And when we look at their heart rate variability, when we look at their sleep, when we look at their circadian rhythms, they're crap, because the person never feels truly safe, is never able to actually relax enough to truly trigger that parasympathetic response. We can help people with sympathetic dominance by helping them develop down-regulation skills. Ultimately, the goal is to help people slow their breathing. When we slow our breathing, it helps activate the vagus nerve, which helps slow our heart rate and trigger that parasympathetic response. There are a lot of different ways that people can do slow breathing, and I have lots of videos on that, so we're not going to go deep into detail on that. However, I have yet to engage or to work with a client who hasn't benefited from at least reviewing down-regulation skills and exploring how their stress reactivity has changed over time as a result of whatever's going on in their life. Sleep and circadian issues. As I mentioned earlier, a lack of sleep keeps our body from being able to detox and rebalance. Every cell in your body has a circadian clock to it. We actually salivate more in the morning and less at night. Our hormones are on a circadian clock. Our neurotransmitters are on a circadian clock. When our circadian clock is out of whack, our body doesn't know if we're coming or going, if it's time to secrete melatonin or if it's time to make serotonin. Helping people stabilize their circadian rhythms can be hugely helpful. Now, what about people who are firefighters and work 24 hours on, or have rotating work shifts, which God help them, that's just so stressful on the body. Or they have a new baby at home and the chances of them sleeping through the night are slim to none. Okay, well, those things are stressors. Let's figure out how we can mitigate them. We can't eliminate them. We're not going to say, well, have somebody else take your kid or quit your job. No, that's not practical. What can we do to mitigate the problems that are being caused? Nutritional imbalances, whether it is eating too much sugar, which promotes insulin and insulin release and insulin resistance, or not getting enough of the basic nutrients that the body needs in order to make serotonin and norepinephrine and gonadal hormones, etc. For some people, especially older adults, absorption goes way down. So what they eat, they can be eating a great diet, but they may not be absorbing nearly as much as they were when they were younger. Or for people who have dental problems, who don't chew their food well, that absorption can also go down. There's a lot that can be going on causing nutritional imbalances. Blood work is the first line of determining B12 levels, anemia levels, your iron levels, vitamin D levels, thyroid hormone levels. All of those can be easily measured with a blood test to get an idea. If somebody is a drinker, a moderate drinker or more, that can also impair nutrient absorption because it increases inflammation in the gut and which reduces absorption, and it really, really reduces absorption of thiamine. People who are chronically stressed have that change that we talked about earlier in their gut microbiome, and they start to develop leaky gut. Now, there's not something that you can just magically do to change that. However, recognizing that, especially if your clients are complaining of GI distress, upset stomach, pain in their gut, gassiness, flatulence, that's an indication that something's, not quite right there. They can talk to their doctor. Ultimately, gut dysbiosis will often heal itself as stress goes down and diet improves, encouraging them to eat fruits and vegetables that are, by nature, relatively high in what we call prebiotics or fiber, and fermented foods like yogurt or kimchi that are high in probiotics. That can be super helpful to repopulating and helping recolonize a gut that's gotten out of balance. Hormone imbalances, thyroid and sex hormones, including, as I mentioned earlier, age-related changes in gonadal hormones, can contribute to systemic inflammation. Blood test, easy enough. And then they can work with their doctor to figure out how to address that, if they're going to address it at all. Neurotransmitter imbalances can contribute to systemic inflammation. Glutamate is your main excitatory neurotransmitter, and norepinephrine is sort of your focus neurotransmitter. When we're stressed, those are much higher, and GABA, your relaxation neurotransmitter, is much, much lower. If glutamate stays high for a long time, you're bathing your brain in stress chemicals, it actually starts killing neurons. Guess what? That's a stressor. So recognizing that may be going on. There's not something that we can do necessarily to rebalance those neurotransmitters exogenously. When you alter, for example, when people start taking an antidepressant, yeah, it alters serotonin levels, but it also alters dopamine and norepinephrine and other hormones and everything else. You almost never, maybe there's sometime you can, but to the best of my knowledge, you almost never can alter one chemical or substrate in the body without affecting a myriad of others. Ultimately, when hormones are more balanced and the body has the nutrients it needs and it's able to rest and rebalance as it needs, and inflammation starts to go down, neurotransmitters will naturally start to head back to that healthy homeostatic place. Immune-related issues can also trigger depression. People with autoimmune issues that tend to have high levels of systemic inflammation tend to have much higher levels of depression and mood issues as well. We start having inflammation in the brain that often contributes to dysfunction in those receptors and increasing of depressive symptoms, not to mention the situational issues that are occurring with somebody with an autoimmune disease when they're having a flare that adds an additional sense of helplessness and hopelessness. Helping people identify if they've got autoimmune diseases, helping people identify what are triggers for your flares, what are the things that you can do to best prevent having a flare, and when you do have a flare, what helps you to rebound as quickly as possible. Loss of function, including sexual function. Many people who experience clinical depression also lose sexual functioning. Maybe it's libido, maybe it's erectile function. Depends on the person. Antidepressants are well known to suppress sexual functioning and libido. Therefore, you may be working with somebody who has a loss of function in this area, and that can be a significant interpersonal, intrapersonal, and emotional stressor if, something like sex just doesn't appeal to them anymore. Chronic pain. Obviously, that is often a sign of underlying chronic inflammation, but it can also be exacerbated When we are depressed, when we are stressed, our nociceptive receptors or our pain receptors become much more hyperactive. So we actually feel more pain when we're depressed, which really sucks. But helping people understand that is not all in your head. You're not exaggerating. You're not, overly complaining. Let's look at what makes the pain worse, what makes it better, and look broadly, not just how you slept or what time of day it is or whatever, but look more broadly at the other stressors in the other pieces of their life to see if you can identify connections between things that may add stress and then consequently increase pain. Medication side effects can be a driver of depression. As I mentioned earlier, statins and beta blockers are two big offenders. And low energy is sort of a consequence of depression. The brain has had too much stress for too long. It's dealing with this inflammation. It's got all this stuff going on over here. It's exhausted. And so the person often has a loss of energy. Not to mention the fact that if they're not sleeping well, they're going to have a loss of energy as well. Stressors in all pieces of life will contribute to the underlying physiological issues perpetuating the inflammation and distress. New mnemonic for you today, sharpen, to evaluate or just to kind of remember what areas of life might be being impacted or what areas of the body might be being impacted as a result of this stressor. Sleep and circadian rhythms, hormones and neurotransmitters, the autonomic nervous system, are they becoming sympathetic dominant? Their ability to relax, their level of pain, their energy, and their nutrition. When experiencing problems in sharpen, any of those areas, how does it impact all pieces of life? When you're not getting good sleep, when you're in pain, when your nutrition is crappy, when you're unable to relax, how does that impact your self-esteem, your self-efficacy, your mood, your brain fog, your ability to tolerate certain environments? And we're going to get there. But understanding and really bringing it back to the body. How is the body impacted with any of these other stressors? Intrapersonal drivers and consequences. So that's within the person. Low self-esteem and shame. Low self-efficacy, and possibly a wounded inner child. If they had a traumatic childhood, if they are regularly continuing to feel helpless, hopeless, unlovable, there may be trauma issues that need to be processed. When people have this going on, they are often unwilling to attempt to develop social support and sometimes unwilling to attempt recovery itself if they don't feel like they're capable of affecting any change. They may have difficulty maintaining healthy relationships, and they may be more likely to stay in unhealthy relationships if they believe that they need to have somebody in their life and or that they're not that lovable, so they better hold on to what they got. They may have a perception of helplessness or ineffectiveness, leading to failure to try anything. And they may have chronic feelings of helplessness and threat. And that goes back to that wounded inner child. If they never felt safe, empowered, loved, or cared for. Thinking again, how does low self-esteem and low self-efficacy, if I don't feel good about myself, if I don't feel lovable, and if I don't feel capable, then I'm probably not going to relax very much to get good sleep. That's going to ultimately impact my hormones. It's going to impact my nervous system, obviously make it harder to relax, may contribute to more pain if I don't feel like I can do anything to change it, or just the stress itself making me more sensitive to pain. And it's exhausting to feel stressed all the time. And, I think of little squirrels and bunny rabbits. They're really at the bottom of that food web, and They are prey animals. They never feel safe. And feeling that way, constantly feeling like you got to be on guard, that's freaking exhausting. And how does it impact people's nutrition? Even if they're eating well, which a lot of times when people are depressed or stressed out, they don't. But even if they are eating well, are they absorbing it? Is it doing what it needs to do? Interpersonal drivers, unhealthy relationships, lack of social supports. We're not made to do life all by ourselves. Insecure attachment style, whether it developed in childhood or there was a humdinger of a relationship or relationships in adulthood that left the person having difficulty trusting others, feeling safe in relationships with others. That obviously can be a chronic stressor. If you're worried, constantly worried that your friends are going to abandon you. Interpersonal trauma, if other people have hurt you before, then, and especially if you don't feel like you're able to protect yourself from getting hurt that way again, yeah, that's stressful. Poor communication skills and unhealthy boundaries. The consequences of these things is they erode self-esteem and self-efficacy. If I don't feel good about myself and I stay in unhealthy relationships or don't feel like I can make friends, or I'm always assuming people are going to abandon me, yeah, that's going to erode my self-esteem and self-efficacy because I'm going to view it through that lens and I'm going to say, oh, they left me because I suck. There's a constant sense of overwhelm. We can't do life all by ourselves. It's exhausting. There's a sense of isolation and vulnerability and a difficulty getting needs met, which compounds the sense of isolation. If you have difficulty communicating your needs, communicating your boundaries, maintaining, asserting your boundaries, then other people may feel very unsafe, or at best, it may feel like other people just don't care. When in reality, they may care. They may just not know what you need because you didn't communicate it. Emotional drivers, anger, guilt, resentment, anxiety, doubt, overwhelm, grief, and low motivation. Your dysphoric emotions are often going to contribute to a sense of feeling apathetic, exhausted, depressed. It's just my energy's going everywhere else but over here. When we're stressed, and I'll get to this on the next slide, but we notice the threats more than we notice the positive things. Therefore, it starts to seem like everything is against us all the time, which contributes or compounds anger, anxiety, doubt, overwhelm. And it's hard to get much motivation if it seems like the whole world is going to hell in a handbasket. Consequences of this, when we have just a myriad of dysphoric emotions, we start to develop sympathetic nervous system dominance. We become hypersensitive to triggers in the environment. Things that we normally wouldn't even notice may trigger us, or we may notice it and compound that feeling of helplessness and stuckness. And emotional dysregulation. Cognitive drivers. Oh, here's another mnemonic for you. Some camp. I don't know. It's what I could come up with. Shoulds, overgeneralization, mind reading, emotional reading, catastrophizing, all or nothing thinking, maximizing the negative and minimizing the positive, and personalization. All of these thought patterns can contribute to people feeling unsafe and powerless, can contribute to people feeling helpless and hopeless. We want to evaluate them and encourage the clients to look at their self-talk, look at their beliefs, and evaluate them based on my good old mnemonic FitCat, the facts in this context at this time, to become more aware of their some camps. Many of us have a few cognitive distortions that we are more prone to use. Increasing awareness of those and restructuring them can help the person feel more empowered, can help the person feel less vulnerable, which consequently will reduce that stress response physiologically and help tone down some of that inflammation. Other cognitive drivers include ruminations, intrusive thoughts, and impaired executive functioning, brain fog, which includes planning, organizing, concentrating, and problem solving. When we are depressed or stressed, which kind of go hand in hand, it's just how it manifests, the brain actually diverts most of its energy to helping us fight or flee. So the prefrontal cortex that does our executive functioning, it's offline. One of the consequences of that, in addition to having brain fog, is that we have more difficulty controlling our thoughts. And a lot of times, if you want to think about it this way, it feels like the amygdala is in control. And it just keeps throwing stressful thought after stressful thought after stressful thought at us, and it's hard to turn that down. It can be ruminating over the same thing or just repeated intrusive thoughts about various things. But that's exhausting, and it's almost like somebody's fighting with you in your own brain, which can make you feel unsafe, especially at night when you're trying to be quiet, when you're trying to go to sleep. As soon as there's quiet, your amygdala starts yelling, there's this threat, there's this threat, there's this threat. What's a person supposed to do? Helping people develop down-regulation skills, progressive muscular relaxation, guided imagery, those things can be helpful, helping them develop tools to manage ruminations and intrusive thoughts in a way that works for them. Some restructure them, some engage in thought stopping. Depends on your client what works for them. And there's perceptual changes, as I mentioned. When we're stressed, our body says, hey, we're in danger, we're vulnerable right now, so we're going to focus on all the threats. We don't need to notice the bunny rabbits and the rainbows because those aren't going to keep us safe. We're going to notice all the threats. Encouraging people to embrace those dialectics and look at, this stuff over here, I'm not invalidating what's going on. This is awful. This is overwhelming. This is whatever. And let's also turn our attention, especially if you can get them to do it for 15, 20 minutes a day, turn their attention for 15 or 20 minutes to what is going right. What went right today, or what is going right in my life. Even basic things like, okay, well, this isn't going as I wanted, but I have a roof over my head. This isn't what I like, but this over here is going okay. Ideally, you avoid the negatives and you just focus on what's going correctly. Not everybody is able or willing to do that right away. When we are stressed, as I mentioned, we have impaired thought control, brain fog, and increased threat perception. All of those things trigger the stress response, which triggers the inflammation, which maintains the underlying physiological manifestations that are perpetuating the depressive symptoms. And environmental drivers, feeling unsafe in your environment. Guess what? If you try to lay down and go to sleep and you're like, I don't know if it's safe or not, you're not going to get good sleep. That's going to contribute to stress, impact all areas of sharpen. We also tend to have reduced sensory gating when we are stressed, which means our ability to filter out unnecessary stimuli drops dramatically. Maybe not completely, but it may drop dramatically. We also become more sensitive to sensory input, or a lot of people do. What used to be a tolerable level of noise may be too loud now. What used to be tolerable smells may feel overpowering now. When we are in that vulnerable state in fight or flight, our brain is hyper aware of what's going on in all senses. So there are a lot of environments that just can be overwhelming. Consequences of an unsafe environment, whether it's overstimulating, understimulating, or just flat unsafe. Reduced sensory gating, irritability, and executive dysfunction. And spiritually, generally, spirituality, lack of a sense of purpose and a lack of a sense of connection to something bigger than them or bigger than now. I want to feel better right now, as opposed to, I don't really want to do this exercise that my therapist wants me to do. Not the most fun thing right now. In the long run, in my rich and meaningful life, it will make a difference. It will help me get closer to that. It will help me remove this obstacle that's keeping me from moving toward my rich and meaningful life. So spirituality is looking at something bigger than the now. Is this helping me move toward my rich and meaningful life? For some people, it has to do with a higher power. For others, not. But helping people define their spirituality and what helps them have a sense of purpose and connection. When we don't have a sense of purpose or connection, we have low motivation and a sense of isolation and disconnection. It's like, nobody cares if I'm here, and why should I even try? Because what's the point? And that sounds in large part like depression. A functional behavioral health approach to depression recovery involves understanding the underlying causes of the symptoms and the issues in all pieces of life that are contributing to the ongoing physiological changes that are causing or maintaining the depressive symptoms. And as I mentioned, we didn't go through a whole bunch of interventions today because I think most of you who are here know a lot of those. But recognizing all of the areas in all pieces of life that we may be inadvertently failing to assess for or account for when identifying what is contributing to this person's mood and, if you want to say it this way, neurological dysregulation. Thank you for being with me today. And are there any questions? I appreciate everybody being patient with Mojo being in here today. We lost Vicky 3 weeks ago, his desk buddy, and then our big black dog that used to come in and lick me in the mouth. Ew. We had to say goodbye to him last week. So there have been a lot of changes, and Mr. Mojo is a little bit stressed out right now. So he's been a little bit more antsy, but I appreciate you being tolerant of his little tail popping up. Wow, Adriana, your responses are on fire today. Couldn't have said any of it better myself. Maybe wouldn't have even said it that well. So thank you for all of your responses today. Let's see. Thank you, Melissa. Thank you, Matthew. You are all quite welcome. I enjoy being here. I enjoy seeing you every week. And I will see you next Wednesday. Same bat time, same bat station. Yes, they do bring a world of joy, CNS. You are totally right. There is lots to digest, but the PowerPoint with some additional hyperlinked articles are available in your classroom, and there is a self-assessment worksheet I put together that may be helpful to look through, modify, use with clients, what have you. Just to kind of really, again, underscore all of the contributing factors and help them feel more empowered and less blamed for the way they're feeling.